Hello friends, today we are going to recall about the NEET PG 2022 question papers, and literally this paper has lot of biochemistry questions, uh, and those are maximally the storage disorders. It is very rarely seen this type of questions in NEET PG. It is mainly seen in initiate papers, but this time lot of questions based on this has been asked in NEET PG. So first question was a question of lipid-laden macrophage resembling crust crumple tissue appearance. Okay, so this is the crumple tissue appearance, and what is the deficiency? And it is the answer should be glucocerebrosidase. And I just want to recall you the other lysosomal storage disorder, that is the firstly the Tay-Sachs. This is the hexosaminidase. Nidase A, and Gaucher. This is the G for G, that is glucocerebrosidase. Niemann-Pick, that is the sphingomyelinase. Metachromatic leukodystrophy. This is the aryl sulfatase. Okay, and the Krebs, this is the galactocerebrosidase. Okay, and ultimately I think this is the Tay-Sachs Fabry, Fabry is, अरे यार क्या हो रहा है, Fabry. This is the alpha galactosidase E. Okay, so this was the question, and this is very important, that crumple tissue appearance. I just remember like C with G, that is why it is Gaucher, and the enzyme is glucocerebrosidase. So the answer should be A. Next is cherry tree never grows so tall. Sorry, it is the mnemonics. And cherry tree red spot is seen in which of the following case? And it is obviously the Tay-Sachs. I have got a mnemonic like cherry tree never grow tall. Okay, so I have just told it. Next is McArdle disease occur due to, and this is a question of myophosphorylase, and there is the disorders like von Gierke, that is the type 1. Next is the obviously McArdle. This is the type 5. McArdle, and the Anderson. This is the type 4. Cories, type 3. Pompey's, type 2. Okay, and this McArdle is for muscle, and this is why myophosphate is the answer. Okay, next, if farmer with discharge from his leg and shows sclerotic body. I think this question already has been asked in this year initiate paper, and this has been again asked in NEET, and this is chromoblastomycosis. Okay, next is the following image shows which of the following bone this is. This actual image has been given, and this is simply Marius. Okay, and this you can easily understand, like this is the lateral process, this is the neck, this is the head. So you have to read the other two bone like incus and stapes for the upcoming exam, so it can be asked. Next is the question on basal cell carcinoma. If you don't remember this histology, you just by the history of this patient you can think of basal cell carcinoma. The history of a ulcerated nodule, obviously the size is very small and has been grown over the medial epicanthic fold, and this is has been asked like it is over the more sun exposed area. So whenever this type of question, there is more probability of the basal cell carcinoma. And just for your sake of interest, this histology, like ovoid cells in nest with single palisadic layer. I think this exactly like image has been given in the exam, so this is the answer. Okay, and next is the question on samtatride, and you know it is very well. This is then due to which drug you have to avoid, because it is due to aspirin hypersensitivity, so he has to avoid the aspirin. Okay, next a parasite on microscopy shows sheathed two nuclei on a tip, and this exact question in previous year has been asked in Neet, but they has been that time given the image, but this time they has given just the format of questions. So this should be the Brugia, and I just remember like LBW, okay, or very simple mnemonic like low birth weight. Okay, so if it is the parasite end, for these all three there is a sheath. Okay, for all these three there is a sheath. For Loa, B for Brugia melai, and W for Uchera bancrofti. And for Loa there is everywhere there is a nucleus, and here there's only two nucleus at the tip and there is no nuclei at all. So this is it, and they already asked two nuclei at the tip, so the answer should be Brugia. Okay, there is a question on RTA leading to develop blood at the meatus, and this has been in the MCU, and I'm not getting the exact image, but this type of this like images has been given because there is a penile urethra which has been, there is normal, this type of image is penile urethra, and there is a bulb like image, and after that there is a like extravasation, and you know this is very well, this is the bulbar urethra, so the answer should be bulbar urethra. Okay, so this is the, I am not exactly getting the image, but I think this should be the answer. Next is the Bitot spot, and they has been given the image and asked which of the following vitamin causes this type of disease. So you know it is very well, this is the vitamin A deficiency. Okay, next, a middle-aged lady with cardified discharge, and what should be your investigation? And I have already told you that the bacterial vaginosis, candidal vaginosis, and trichomonas vaginosis is a very important topic for any exam. Okay, so this should be the sabrodextrojaga because this is a candidal vaginosis. Okay, in which pH is less than 4.5. Okay, so, and for your sake you have to also read the difference between bacterial vaginosis and candidal vaginosis, and obviously the trichomonas vaginalis. So this is the first 10 questions of the Neet PG. So thank you friends for viewing this